Well, thanks everyone. It's great to see you here. Ko Cheryl Toka Wingua, he tangata Tiriti Aho. I'm with the Centre for Family Violence and Sexual Violence Prevention, and we're here with a session today with Dr. Lesley Campbell, who's going to talk about the community-led response to family violence following the Canterbury earthquakes. And we think it's a really timely opportunity to be thinking about how we get prepared for the next natural disaster, the next epidemic, the next international conflict, the whole environment we're all thinking about at the moment, and also how we prepare and support our community to recover. So Dr. Campbell's got 25 years experience in strategy and policy and research across the justice, health, education, social sector. She's the director of Lebern and Associates, Lebern, hopefully I've said that right. And she leads diverse research projects in the social services and disaster recovery. So after Lesley does a presentation of about 15 minutes, there'll be some questions facilitated by Sate Eti, who's one of our national system practice leads here at the Centre for Family Violence and Sexual Violence Prevention. And we really encourage you to add your questions into the Q&A there. You'll find that function at the top. If you've got any questions about the research, please add them in there, and then Sate will facilitate that. Just to let you know that we want this to be a really safe and inclusive space. We're going to talk about topics of family violence and sexual violence that can be difficult or distressing. So please do what you need to do to keep yourself safe and to look after yourself. We're going to post, or we already have actually posted the links to the help portals where you can have a phone call, online chat, find out more information from their websites. So have a look at those. And in this version of Teams today, all you can do is sit there, watch, and add your questions. So we really encourage you to do that, and then to have a conversation with your colleagues afterwards as well. Just to let you know that that Q&A is public, so everyone's going to see that. So now I'm going to hand over to Lesley. Thank you so much for joining us, Lesley.
Thank you, Cheryl, for the introduction. I'll just do my pepe hana. Tēnā koutou katoa, ko ngā ko hatu whakaraka o tamatia pōkai whenua te monga, ko waimohi te awa, ko etiara ina rangi te whenua o oku taipuna, no otatahi aho, no Campbell toku whānau, no ko Lesley toku ingoa. No reira, tēnā koutou, tēnā koutou, tēnā koutou katoa. Well, look, thank you to the Evidence to Practice people for inviting me to talk about the Canterbury earthquake events, and I'll just... Okay, so family violence is a major issue that affects the lives of many New Zealanders and creates significant economic and social costs across society. And New Zealand is one of the highest rates of domestic violence in the OECD. So you can see from this slide, a third to a half of New Zealand women experience physical or sexual violence from a partner in their lifetime. 35% and 25% of men experience sexual offence. 292 people died from family violence and related homicides in that 10-year period from 2009 to 2019. 478 family violence investigations were recorded by the police last year, and over 27,000 police safety orders were issued. And this is in Christchurch. So, you know, it indicates the intensity of the family violence incidents. New Zealand police record a family violence incident every 3 minutes, and it costs between $8 and $10 billion a year for family violence recovery, and sexual violence costs 6.9 billion per year. So very expensive, both socially and economically. There's now a significant body of post-disaster settings research that shows that family violence increases massively after disasters. And we've got, several years of data here on this slide. I won't go through them all, but, the latest one was the 2023 COVID-19 lockdown, where police investigations increased by 22% and 20% increase in calls to women's refuge. And then the 2023 Hurricane Gabriel, a 60% increase in family harm. So what explains this rise of violence and vulnerability? I think there are a number of factors underpinning this. The breakdown of social structures and loss of social support, so people are isolated. There's the stress of unpredictability. There's increased alcohol and drug use. There's feelings of powerlessness as people struggle to go about their daily lives. There's lack of economic security, so quite often people will lose their jobs or lose their workplaces. And there's a lack of housing, secure housing. And, several years after the Canterbury earthquakes, the Canterbury Recovery Authority did a survey, and they found that 4/5 of our community was still showing increase in drinking rates, and Canterbury had the highest rate of antidepressants of any of the regions in New Zealand. So that was about 4 years after the 2011 Canterbury earthquake events. The Canterbury earthquakes of 2010 and 11 resulted in loss of life, injury, and massive damage to key infrastructure and services, strongly increasing the risks associated with family violence. And such risk factors are increased both immediately and in the longer term. So this slide shows the immediate responses to family violence following the 2010 and 2011 Canterbury earthquake events. And you can see that, there was an increase in police call-outs, increase in family violence offences reported, and an increase of reports of concern to Oranga Tamariki. And those raised incidents still exist. And then in the longer term, so Canterbury data in 2014-15, so that's 4 years after the last Canterbury earthquake series, there were over 10,000 family violence investigations undertaken by Canterbury Police. And this represents about a 10% increase from the previous year. And you can see that the women's refuge data, they had increases in crisis calls and the use of their refuge services. So what did the Canterbury community do? The Canterbury leaders thought that even though we'd had this crisis, it provided a seed of opportunity and can provide the catalyst for new and different ways of doing things. And so they decided to gather together a group of stakeholders, across sector stakeholders, to surface good ideas and innovations and to create a space for stakeholders to do that. So in late 2011, they held a cafe conversation and a values hui. And in 2012, early 2012, we initiated the Canterbury Family Violence Collaboration. And the new approach was we're facing the issues of family violence and sexual violence using a system-wide whole of community approach and actions, and not that couldn't be undertaken by any one agency. So a true cross-sector collaboration of actions. So our vision, we got together a reference group of about 40 agencies, I think, in 2012, and they explored some guiding principles and in the beginning looked at a purpose that was going to fit with the diverse range of individual agency purposes, so almost like a holistic purpose. And they wanted to balance the values, or include the values of non-judgmental, high listening and tolerance. And so our vision, or our purpose, was a community that values respectful relationships, a community where families, whānau and individuals do not use physical, sexual or psychological violence. And we also introduced a couple of cultural frameworks, the Tītiriti o Waitangi relationship framework, which seeks to contribute holistic well-being of iwi, hapu and whānau, so balances wairua, hinengaro, ngākau and tinana, and a multicultural framework that's founded on the strengths of diversity and draws on an array of perspectives and is inclusive. So the structure of the collaboration is, it's not a legal entity, so it's just a partnership between the members, and they're governed by a terms of reference. They are comprised of a reference group, which is all the members of the collaboration, and I think nowadays there's about 76 members. And they provide advice, the workforce needed to run the various projects, and support the whole running of the collaboration. They elect a steering group of roughly 12 people from government agencies and NGO agencies and those with lived experience. And currently there's Te Pata Ora, Ministry of Justice, Oranga Tamariki, etc., as well as some of the local NGOs are involved. And the Barnardo's currently holds the budget and the HR responsibilities on behalf of the collaboration. So any monies that are raised are taken care of by Barnardo's. And they also employ the project manager and a communications coordinator. And then we have a number of work streams, so staff learning and development, prevention, housing, etc., etc. We also invited Ngāi Tahu to offer us a kuia, and Tirahia Kipa was chosen. Unfortunately, Tirahia died a couple of years ago, but she contributed made a magic contribution to our collaboration. So what guided us in terms of deciding on our work streams? we looked at the evidence base, and we decided that primary prevention was a key focus for preventing, recognising and responding appropriately to family and sexual violence, but particularly prioritising the needs of vulnerable groups like youth, refugees and migrants, disabled people and the rebuild workforce. And the awareness campaigns not only provided people with, what to do in a situation of family violence and what are the agencies that can help, but also influences the social and cultural norms that related to environments, and encourage people to take the no wrong door approach. Workforce development, ensure that those working in human services have undertaken training to identify and respond appropriately to family violence, and also to share our specialist knowledge across the system. And data and research, we realised that at that time there was a paucity of data on situational analysis and impacts of programs or collaborations of work, and what outcomes they were achieving. So achievements in the primary prevention project, we ran a Canterbury Can Stand Up Against Violence campaign, and we got 8 well-known Canterbury celebrities to front these campaigns, and there you can see Sir Mark Solomon. And we developed over 2,000 posters, 2,000 cards, back of the bus posters, attended 14 events where we distributed all of this, and 100% of people who had been at these events thought that they had seen our messages on these Canterbury Can Stand Up Against Violence campaign. We also did a Pacifica campaign where we went into 5 Pacifica churches and delivered messages of where to go for help for family and sexual violence in their own language. We employed we conducted the White Ribbon campaign with Te Whatu Ora, and the number attending our first year after the Canterbury earthquakes, the first year there were an increase of participants in that walk from 500 to 1,500. So we were delighted with that. And we also joined forces with Pegasus Health, which is a primary health organisation here in Canterbury, to develop a welcoming communities wellbeing and information pack, which we shared with across construction industry. So as they were inducting new people into their industry, they would give them this welcoming pack, but also shared it across refugee and migrant agencies, across libraries, across schools, you name it, we did it. And then more achievements. To the top left-hand side, we this is our youth youth work stream, and we did a performance with No Limits and a Kapapa Māori agency here in Christchurch to over 1,500 school students, and it was addressing the issues of alcohol and drug and family violence. To your right-hand side at the top, we ran 4 symposiums which taught people about how to respond to sexual violence and family violence, but also the no wrong door message. The left bottom part of the slide is a careers video that we did as part of our workforce development work stream, and it told the stories of people who are working in the family violence sector and what wonderful feedback they got, and how rewarding it was. And we also ran a number of data and evidence projects. So we did, and an example of this was to do with emergency housing. So we did a literature review, and then we did a post-earthquake data collection, which told us that 47% of clients that were presenting to human services presented with both housing and family violence issues. And the major issues were overcrowding and lack of affordable housing. And as a result of that, MSD contracted with Vision West and Comcare to provide short-term emergency housing for a number of people who were experiencing family violence for an 18-month period, which was fantastic. Success factors. I think, having a compelling and agreed reason and a purpose. So, of course, we had an increase in the intensity and, I guess, complexity of family violence following the earthquake events. But we also recognise that family violence is a wicked problem, and the whole of community response and diverse community stakeholders need to be involved. So we intentionally cross boundaries, and in the earlier slides I mentioned we worked with Business Canterbury, we worked with health agencies, mental health agencies, justice agencies, kaupapa Māori agencies, Pacific Peoples, refugee and migrant agencies. So we tried to work across boundaries. So we had the compelling reason. And I think the purpose I explained earlier, that we needed a purpose that was going to ring true for all of the people who were part of the collaboration. And we chose a community that values respectful relationships, a community where whānau and individuals do not use physical, sexual and psychological violence. You must build on pre-existing factors, and in Canterbury we had a huge history of cross-sector networking. So social service providers Aotearoa, Right Service, Right Time, and the Canterbury Clinical Network are three collaborations that were operating in Canterbury at the time of the earthquake events. And the collective experience of the earthquake events, I think it brings people together, so people naturally collaborate. So they were our two of our three pre-existing factors. And the third one was the evidence told us that dealing with family violence involves collaboration, sector-wide, and an ecological approach. We used a mix of system, network and coordination models. And by that I mean, collective impact recognises that collaborations require crossing boundaries. So it's not just the family violence sector, it's everybody in the community. And a distributive leadership model. And by that I mean, just allowing people to naturally use their expertise to raise themselves into leadership positions without a natural role. So and be across the sectors as leaders. And the models of the system network models needs to be married together with a coordination model. So we had backbone support, which was the project manager and the communications coordinator, and they built the support from the stakeholders, collected data for decision making, mobilized funding, wrote the strategy, did those backroom types of things. And using a distributive style of leadership and network approach requires diverse communication channels. So we had regular purposeful meetings. We used social media. We used our website. So we just tried to use as many forms of communication as possible. The challenges, I think, the staff who made up the collaboration became exhausted at one point in time, and that's because they were hearing so many traumatic and terrible stories of family and sexual violence during the period, but also because that in their personal lives they were dealing with the earthquake effects, and so getting people maintaining their active participation was a problem. People were working on a voluntary basis over and above their workplace roles. And I think securing funding was another issue. Then government agencies were used to funding single agency, single service, distinctive length services, and weren't used to collaborative longer term outcomes, and so that was an issue. And we tried to counter that, try to counter the engaging the workforce by sharing training that is free. We used the RBA framework so that people could see that the outcomes they were achieving in their work streams linked to the population outcomes. And we involve people in cross-sector, building cross-sector relationships, and I think people found that rewarding and helpful in their own work. And demonstrating outcomes for individuals, families, whānau, and communities. That's always a tricky issue, getting contribution from a collaboration when there are many other factors in the environment that could have contributed to that. But we tried to collect data on knowledge, behaviour and attitude changes, which are the short-term outcomes, and then develop an intervention logic that linked those short-term outcomes to the longer-term outcomes. And opportunities for the future. My thinking is that we always need to co-design with co-design family violence services, policies, strategies with survivors to ensure their needs are met. So having the lived experience is really important. Training first responders to recognise and respond to family violence. The government guidelines, I was thinking about civil defence and emergency management. I did a project with the New Zealand Red Cross about including how to engage with disabled people following an emergency, and that worked to treat. So, having something around family violence in those higher level government guidelines would be helpful. Establish relationships with service providers and levels of government before an active disaster response. And I think I found that is, works a treat with the called community. So we are actively, here in Christchurch, actively working to create relationships with various ethnic communities. All collect data about the situation and outcomes. use non-traditional people and who to call cards. So that could be the postman, the delivery person, anybody really who could get into people's homes. During the COVID events, the hotels in Canterbury weren't being used, so we could use those as safe havens for family violence, families affected by family violence, using texting and animal fostering systems, because often people won't leave a violent relationship because of a fear of leaving their pets behind. So that's me, and I'm open to questions.
I love Dr. Lesley Campbell for the comprehensive and rich presentation. It is my privilege now to guide us through some questions and perhaps have a conversation around the presentation. Lesley, it seems like the key takeaway from the presentation, and I know there's so much richness there, but in terms of a key takeaway for us to ponder on is the idea that disasters don't create family violence. In many ways, they accelerate what is already an existing crisis, and it locks family violence or that particular internal crisis into a higher gear. And we can't wait for another event. We've really got to start to build the networks during peace times, so to speak, because what you've just walked us through is really not just about Canterbury or earthquakes. It's a story about what happens when an existing crisis, such as family violence, meets a moment of environmental disruption, whether it be an earthquake, COVID, or Gabrielle, and how a system either rises to meet that crisis or fails to meet that crisis. So I'm going to perhaps go a little bit deeper in terms of where it all kind of started, this response. And it seems to me like it was a relational response. You didn't start with a policy paper. You started with a coffee conversation, a cafe conversations, and a values hui. So for a sector that's quite often engaged with frameworks, with governance groups, with terms of reference, what was it about the coffee and the invitation that made 45 agencies stay engaged? I'm curious about that, please.
Yeah.
Lisa.
I think we had a regional leaders forum here in Canterbury, and still do. So they're government leaders who are high-level senior managers who meet regularly to discuss the wicked problems, I guess, and how they can work together. And I think their leadership guided us in terms of people wanting to come to the cafe conversation. But I also think that the Canterbury Clinical Network was an amazing collaboration of more practiced people and, so doctors, nurses, allied health people in the social service sectors. And they had been working splendidly together. I guess it's a synergy, isn't it? It's when higher leaders synergize with practice people at a particular point in time with a wicked issue, then that what makes people want to meet and solve problems. And I think the other thing is people get sick of the same old, and they are really interested in innovation, new ideas, anything that's going to help their client group. So I think that was probably another thing, because I can remember that cafe conversation and it was buzzing, And I think also, you're talking about a non-disaster situation, but I think because we'd experienced the earthquake events together and all of us had been affected to some degree or another, that brought us close together. It was extraordinary, how collaborative people were in those immediate years following the earthquake events. So I think if we, like, purposely in our roles try to collaborate outside our normal workplace, set aside some time every month to meet some new people, to share, coffee with people. I think that really puts us in good stead for when a disaster occurs, but puts us in good stead anyway.
Yeah, I love that. I love what you're saying there in terms of, because what really came out clear that this is not an individual approach, right? This is just not one layer of workforce or one layer of governance. This is the entire system that we're talking about here.
Exactly.
We can't do that alone. And I think that comes really clear. And this whole idea of stretching beyond your particular silo, your particular frame in terms of perspective.
Well, if we look at the background features of family violence, there's alcohol and drug abuse, there's mental health issues, there's insecure incomes, I guess. They're all factors that we can't, as a family violence sector, can't do on our own. So we need to go and see our kāinga or our colleagues, go and see our mental health services and form relationships with them, and then work together to get a plan of action for whānau so that they can address those underlying causes of family violence. Because unless we do that, we're just putting a band-aid, I think, on, and not always, but sometimes. So I think wicked problems require cross-sector engagement, and cross-sector engagement involves forming relationships.
Wonderful. I'm just going to check now whether there are any questions from our audience, and I'm just going to click on, let's see. Okay, I've got a question here. That's okay. I'm just going to read that out. A common social narrative is we are in a climate emergency and a cost of living crisis. Do you think these social issues and the narrative around them creates the same risk of family violence as a natural disaster such as an earthquake?
Oh, absolutely, because the climate change events that are happening form the disasters, like the floods and the cyclones and, you name it. But it's also the uncertainty, of climate change, that we don't know whether tomorrow we're going to be in the middle of a blizzard, or we don't know whether we're going to experience an earthquake event. We just don't know. So the uncertainty, which is a hallmark of family violence, and I think the cost of living crisis, that goes to food insecurity, rental accommodation insecurity, school insecurity, like children being able to go to school with their full uniform, with lunch, those kind of things. So yeah, I absolutely agree with the person who asked that question. They are the very things that fuel family harm. And so we need to be getting underneath the family harm things and addressing those issues.
Wonderful. So I wouldn't mind asking, in your success factors slide, you had a couple of things. A compelling and agreed reason was one of them, and also predisposing factors. For those of us that are trying to stand up something similar to a Canterbury collaboration without an earthquake to galvanize them, how do you think, what are some of the things that we can begin to consider now that we're in calmer weather, so to speak?
Well, I think if we're focusing this conversation on family harm, we're still have high rates of family violence across the OECD. So it's not gone away, and the complexity of those problems has got more complex, I guess. I think building cross-sector relationships should be a must for all human services workers. I think you get an incredible amount of, like going to community meetings, and you get an incredible amount of useful information and form relationships with those. So I think we can do that. And we can think about in our community, so we can use data, collect data from the family harm services to find out what the underlying reasons are for presentations of family harm, for example. And if the main reason is alcohol abuse, then we form relationships with our colleagues in the alcohol recovery sector and address those issues across the community, because we don't want to stigmatise people who have experienced family violence. This is a whole of community issue, and I believe we all have a level of responsibility for family harm. If I hear somebody yelling next door and I don't do anything about that, then I'm responsible if somebody gets hurt, because I didn't report it. So I believe that these wicked problems are community problems, and we need to take a community development approach to it.
And that does seem to be the theme, doesn't it? And again, the theme is about relationships, building networks, building relationships, sharing ideas.
Yeah.
There's never one organisation, one agency. It's this collective, this ability to connect, to collaborate, to talk.
But I think action too, because people soon get sick of going to meetings where it's all talk and no action. And so I think, selecting 2 or 3 things that you can realistically do and are committed to doing is because we can't change the world in a month. We've got to work at the most compelling underlying reasons and work to solve those as a community.
I'm just going to check whether we have any other questions from the audience before I give you perhaps be our final closing question. Just check, there's nothing there. So the final question for you, if you don't mind, Dr. Lesley Campbell, from what you've learned from all the research, what should the family violence sector be doing now to prepare for disasters in the future? Take your time in answering that.
I think it's aligning national, regional, community and lived experience goals so that we're all working towards the same end. I think so. I know that there was a lot of consultation with the most recent strategy, and I think that's great. But regions need to align themselves, should contribute to the submissions for a strategy, but align themselves with the strategy in their own individual way, because each region has a particular uniqueness about them. And so, acting out a particular action might not necessarily suit a particular community. So I think that's really important. And, the peer support regime has become a favoured way of addressing issues. And I in my own experience, hearing the stories from people with lived experience, and no matter what it is, always surprises me, because I think I know what they're going to say, and they always come up with something that I think I would never have thought of that. So I think having the lived experience, both in our teams, our government and non-government teams, but if we don't have that, then inviting people to share their experiences and what they think would help is really important. Yeah.
Thank you for that. I love the idea of aligning national, regional, community, and anchored in lived experience.
Mm.
I wouldn't mind, if it's okay, could you tell us a little bit more about the peer support regime and the effectiveness of that, and perhaps your ideas as to why it was so effective?
Well, I've recently been doing some work with peer support in the emergency department here in Canterbury. And people who come into the emergency department may not necessarily come in with a health reason. They may come in with a mental health reason. And having peers who've experienced mental health to talk to them and provide support has been extraordinarily successful. And the feedback we get from the clients is you can trust a peer support person and they understand, whereas people who don't have that experience maybe don't have the depth of understanding. So that's, I think, and also, I think that peer support people need to be well supported, that occasionally they can be triggered by a story that they hear from a client. And so having ongoing support is absolutely essential for them to make sure that they aren't badly affected by the stories they're hearing. But yeah, it just occurs to me that peer support 10 years ago wasn't a thing, and nowadays it's the thing.
Yes.
Particularly in the health and mental health sector.
Wonderful. Thank you so much for that, Lesley. I'm going to check with Cheryl.
Thank you. Thanks so much. Thank you very much, Lesley, for your presentation and reminding us of all the really important work that went on in Canterbury and still continues, as we saw in the chat. Someone has posted the link to the latest iteration of the collaboration. So thank you very much for sharing that. And I've also put a link to your research.
Lovely, thank you.
And thank you so much, Sati, for the great discussion and conversations. So we hope that you found that useful, really, really great reminder around the importance of community leadership, around that purposeful collaboration and working across boundaries. And I really liked what Lesley had reminded us about that local system focus. It reminded me of during the COVID-19 pandemic, the pandemic working group started as a way for the people in the family violence and sexual violence sector to talk with some of the government agencies and find out what was going on in communities across the country as well. And that forum, while it was created with that urgent need then, has continued and is the system working group that meets every month online to keep everybody informed about what's going on in the family violence and sexual violence space in Aotearoa. So it's really good that some of those collaborations and networking opportunities and information sharing have continued all the way through that. So thank you. Thanks, Lesley. If you'd like to get on the list to receive more information, please email us at the relationships@preventfvsv.govt.nz, and we'll see you again hopefully in May for the next evidence to practice session. I'll close now with a karakia to clear the path for a safe and productive day for you all. Thank you. Kia tau te rangi Māori e ki runga ina iwi Aotearoa. Haumi e, hui e, taike.